Are you living with rheumatoid arthritis, RA? Do you ever think about how it might be affecting your heart health? If you're nodding your head right now, you're not alone. Many people with RA focus on managing their joint pain, but they may not realize that their condition puts them at a higher risk for heart disease. This connection isn't just a minor detail, it's a vital health concern that could affect your quality of life and longevity. Today, we'll explore how RA can lead to serious heart issues like coronary artery disease, heart failure, and even strokes. By understanding this connection, you can take proactive steps to protect your heart while managing your RA. Understanding rheumatoid arthritis. Rheumatoid arthritis is more than just a painful joint condition, it's a chronic inflammatory disease that can have widespread effects on your body. In RA, your immune system mistakenly attacks your joints, causing inflammation, pain, and swelling. But here's the kicker: this inflammation doesn't just stop at the joints. It can also harm your heart and blood vessels over time. Studies reveal that people with RA face about a 21% increased risk of heart failure compared to those without the condition. This statistic is alarming and should make you sit up and take notice. The link between RA and heart disease. So, why does RA increase your risk of heart disease? One primary reason is chronic inflammation. Inflammation is like a fire in your body. When it burns too long, it can cause damage to your circulatory system. Picture your blood vessels as highways for blood flow. Chronic inflammation causes plaque to build up on these highways, leading to blockages that can restrict blood flow to the heart. This can cause serious problems, such as heart attacks and strokes. Common risk factors. RA and heart disease share several common risk factors, which can explain why those with RA are more likely to develop heart issues. Let's break down some of these factors. 1. High blood pressure. People with RA often have less elastic arteries, making it harder for blood to flow freely. This can lead to high blood pressure. When blood vessels narrow, they restrict blood flow, increasing the pressure. Low levels of activity, poor diet, and certain medications can contribute to this issue. 2. Metabolic syndrome. About 40% of individuals with RA also have metabolic syndrome, a cluster of conditions including obesity, high blood sugar, and abnormal cholesterol levels. This syndrome nearly doubles the risk of heart disease. 3. Obesity. When joint pain makes exercise challenging, weight gain becomes a likely outcome. Obesity can exacerbate cardiovascular problems, as fat cells release substances that lead to systemic inflammation. 4. Smoking. If you smoke and have RA, you should be especially concerned. Research shows that smokers with RA are 50% more likely to experience cardiovascular issues than non-smokers with RA. Smoking damages blood vessels and contributes to artery narrowing, creating a perfect storm for heart disease. 5. Atypical lipids. People with RA often have imbalanced lipid levels. They may have high triglycerides and low levels of good cholesterol, HDL, both of which are risk factors for heart disease. RA medications and heart health. While RA treatments are vital for managing symptoms, some medications may also pose risks to heart health. Nonsteroidal anti-inflammatory drugs, NSAIDs, these are common pain relievers for RA, but some, like rofecoxib and valdecoxib, have been linked to cardiovascular issues and were removed from the market. Even over-the-counter options like ibuprofen and naproxen can increase the risk of coronary artery disease. Glucocorticoids, medications like prednisone can also elevate the risk of cardiovascular events. Janus kinase inhibitors, these newer RA treatments may have similar effects on heart health. Monitoring your heart health. If you have RA, regular monitoring can help catch heart problems early. Here are some recommendations. Cholesterol checks. Get your cholesterol levels checked at least every 4 to 6 years. If you have high cholesterol, you may need to check more often. Blood pressure monitoring. Have your blood pressure checked at least every 2 years, or more often if you have high blood pressure. Annual physicals and EKGs, depending on your age and risk factors. Consider an annual checkup and an EKG to monitor your heart's health. If you experience chest pain or other symptoms, ask your doctor about a stress test. Recognizing symptoms of heart disease. Heart disease can be sneaky. Many people don't notice symptoms until the condition is advanced. If you have RA, keep an eye out for these warning signs. Chest pain. This can feel like pressure, tightness, or discomfort in the chest. Shortness of breath. If you find it hard to breathe during regular activities, this could signal a heart issue. Fatigue. Unusual tiredness or weakness, especially during physical activity, can be a warning sign. Swelling. Watch for swelling in your legs, ankles, or feet, which may indicate heart failure. Taking action. It might feel overwhelming to consider how RA impacts your heart health, but there are proactive steps you can take to reduce your risk. Maintain a healthy weight. Strive for a balanced diet that helps you manage your weight. Foods rich in omega-3 fatty acids, antioxidants, and fiber can help reduce inflammation. Stay active. Engage in regular, low-impact exercises that don't stress your joints. Walking, swimming, and cycling can be great options. Quit smoking. If you smoke, now is the perfect time to quit. Your heart will thank you. Manage stress. High stress can contribute to inflammation and heart issues. Consider practices like mindfulness, yoga, or meditation to help lower your stress levels. Medication awareness. Talk to your doctor about the medications you take for RA and their potential heart-related side effects. They can help you weigh the risks and benefits. Conclusion. Living with rheumatoid arthritis can be challenging, but you don't have to face the risk of heart disease alone. By understanding the connection between RA and heart health, you can take actionable steps to protect your heart. Be proactive about monitoring your health, recognize the warning signs, and don't hesitate to reach out to your healthcare provider. Remember, you are in control of your health journey. Your heart deserves the same attention and care as your joints. Let's work together to ensure a healthier future for you.